According to Dr. David Spiegel, denial is not an effective strategy for dealing with health issues. He's the medical director of the Center for Integrative Medicine at Stanford University School of Medicine. His education on the mind-body connection and cancer came crashing down in front of him while interfacing with the patient. This is when he learned that the patients have much to teach the doctor. Dr. Spiegel has turned out to be a wonderful student and has furthered the research into the stress indicators that foretell the development of cancer.
The main idea is that one of the things about stress is that we have these stress response systems, and one of the primary ones is a hormone in the blood called cortisol that basically is there to increase blood sugar to get you ready to fight or flee. So your brain is working, your muscles are ready to go. And obviously, if you had the cortisol turned on all the time, it would be like racing the engine in your car all the time. When you needed the gas, you wouldn't have it. So we need a system that quickly turns itself on when you're stressed, but then turns itself off when you're not. Now, one of the things that happens with people who are depressed or who have post-traumatic stress disorder is that their cortisol regulation is out of whack, and so they'll have cortisol all the time. Typically, for example, waking up is a daily stress task, and our cortisol levels are 4 times as high in the morning as they are in the evening normally. And you've got to do that to get your body ready to deal with the day. But we found that a substantial proportion, about 2/3 of our metastatic breast cancer patients, had these abnormal cord patterns, where instead of being high in the morning going down in the evening, it was high throughout the day, or it would start low and actually increase.
And does this defeat the immune system?
Well, that's good. That's a good point. So glucocorticoids are potently immunosuppressive. That's why we use them to treat autoimmune disease, like arthritis, for example. Very powerful way of suppressing immunity. The immune story with cancer is complicated, but there are certain cells, like natural killer cells, that are lower in women who have these abnormal cortisol patterns that also do, in fact, help the body to fight cancer, to identify and fight transformed and dying cells. And so what we found was that the women who had the more abnormal cortisol patterns actually died significantly sooner than the ones who had normal patterns, independent of all the other risk factors we know about. And the psychologist who was the first author on that paper is now at the University of Louisville, Sandy Sefton, has just found that the same is true for lung cancer. So, and there's another group that has found it for GI cancer. So it seems pretty clear that this disrupted stress hormone pattern is indicative of the body's having difficulty fighting off the cancer, and you'll die sooner if you have the abnormal patterns.
For the full interview, go to ConsciousMediaNetwork.com.